So MJ's the one that asked me to give this talk, and she said, make it crossing cultures. So my experience is somewhat limited in that relatively new attending here. But I have had the privilege of volunteering abroad in both Kenya and Laos during my training. And so that's where many of these cases come from. But first of all, there's no disclosures to be made. And what we're going to talk about is cross-cultural communication. And in my interest of global health, one of the great resources that I personally have used is the University of Minnesota online education. And so the method that they teach there, which has been in the research clearly for forever, longer than I've been alive, since 1983.
You are so young.
It's called the LEARN model. And it's well validated as a way to touch on both everyday topics, which is one of the topics that I'm going to talk about here, is something I came across all the time in Lao. But then also you can use the same model for approaching end-of-life discussions and code discussions, and it's just applicable to all types of cross-cultural communications. And so what it is, as you can see, learn on the side. So you listen to the patient's explanation of the illness using those open-ended questions that we tend to gloss over in the ER sometimes. We're like, why are you here? What are you sick with? This is the diagnosis. We'll go Western medicine model. But a lot of it is asking, like, what do you feel is the cause of your problem? And what do you feel would make you better? And how do you feel your illness is affecting you, to get kind of their impression of it all, so that they can also tell you how their model of their culture has implicated it. And then the E is we explain our medical diagnosis, and in plain, easy-to-use English with a translator if they need it. Oftentimes they do, but sometimes you're crossing cultures and you don't even realize it. There's many examples in literature even about, one of the examples they gave was down south. People with hypertension think that drinking pickle juice helps because it flushes out the evils. And pickle juice clearly has a lot of sodium in it and is hindering them. And so you're crossing cultures even within America. And so once you know what they think the process of their illness is and what we think it is, you acknowledge the similarities and differences to try and get them to buy in and show where our thoughts are different, but then more importantly, how they're alike, so that they can see that what you're recommending is not completely out of left field and it makes sense to them and helps kind of frame it all. Then you recommend a course of treatment. Typically we use medicines, but sometimes you've got to use the other realms you have too, like honey for cough for those families that don't like medicines. Honey is an acceptable alternative. And if whatever they're doing isn't harmful, you can include that in your treatment plan and you get buy-in that way too. If it's harmful, like the pickle juice example, this is also the time where you negotiate and recommend not using it. And the last step in learn is negotiate it. So getting the buy-in, having them say, yes, I can do this, no, I can't do that, and understanding why they'll do what they'll do and why they won't do other things, so that you can go back through the learn cycle each time you see them, so that you can get more and more each time towards what's actually going to make your patient healthy. So the example that I brought that just walks through it is an example from when I was in Lao. It's an infantile beriberi example. So this child presented, he was 2 months old, Hmong, brought to our ER because he's extremely fussy for the last 4 hours. Mom reported that he was eating okay just a few days ago, but it's progressively worsened. He's vomiting with his feeds, taking longer to eat, taking less, and sweating with his feet. So symptoms of heart failure right there. He's exclusively breastfed, and mom follows what they call a taboo diet, which we'll touch on in a second. And she brought the kid in because she knows other children in her village have died shortly after the fussiness begins. So she's really, really concerned about this fussiness, more so than the decreased PO intake and the sweating with feeds that to us say heart failure. So on your exam, you have a kid that's tachycardic, but not so tachycardic that they're an SVT, is tachypnic, has a pulse ox of 84%, and they never do blood pressures in Lao. It's seemed, and so I have none. But he's really fussy. He's got central cyanosis, a murmur, a gallop. His liver is down, so everything that says he's in heart failure, but looks well hydrated. And so at this point, we're like, okay, sick baby, must do something. And the something that you do, actually, is you give him iron thiamine. Place him on nasal cannula, and you admit for obs. No other treatment for heart failure, and he turns around. He's off his oxygen. He's not cyanotic anymore, and the fussiness resolved. You have your diagnosis of infantile beriberi. And so using the LEARN model, you've saved the baby, so now it's time to talk about preventing it in the future with the baby. And so using the LEARN model, you listen first. And the first part is, what does mom think it is? And there's a culture there for the taboo diet, and it's all done to help the kid be healthy. It's a very traditional thing where they're food restricted and they live in this hot hut, for it varies on what village they're in, but all the food must be brought to them. There's certain foods that they avoid. And so it's very high in carbs. Usually it's the sticky rice, the unpolished, or the polished rice, so not like the purple or the blackish rice that has the husk on it, which actually has thiamine in it, and very low in your fruits and vegetables. And some of the beliefs, that depends again on which region you're in, is that grilled foods without the fruits and veggies prevent the heart failure and heal the internal organs. So they feel like they're preventing what we just treated in this child by avoiding it. White-skinned animals, so chicken is one of their common foods, causes weakness, so mom's not getting protein at this point. And some colors of foods are problems too. Like there's something about yellow and causing jaundice. And so you've now learned why mom has this very strict diet. And if you actually examine mom, she can't stand up from a squat because she has dry beriberi as well. And so you have to treat mom and baby. So that's the listen part of it. You know she's doing it not to harm her baby, but to make them healthy. And the other part is she's afraid that eating the wrong foods will cause this, or she's eating all the right foods and doesn't understand why it happens. So now we explain the diagnosis. So it's a highly treatable vitamin deficiency. And if it's not treated, you've got the 10% mortality with a high morbidity, in that the kids will go on to develop neuropathies and learning disorders and developmental delay. And so the kids in her village that have died were in that 10% of untreated beriberi. And so mom now understands it's a serious illness. And so now you acknowledge that we both agree that mom's diet affects the infant's health. Our conflict is that mom thinks the taboo diet is beneficial, where we see it as the cause. And the other agreement we have is breastfeeding is best. It's the safest way. Water is highly contaminated there. Formula is very hard to come by. We want mom to bond with the infant. And so she's choosing the best way to feed her baby. So we want to support that. So we have mom on board, which we're still going to breastfeed, but we're going to recommend that we continue to treat the baby. And then we transition to oral because they're so thiamine deficient that it takes 3 weeks. But you treat mom as well so that her breast milk has what it needs in it. And you address some of the taboo diets. Like you can actually add eggs. It's not considered a white meat there, and it's high in thiamine. And so boiled eggs, hard boiled eggs is all mom needs to add. Add a little of the right fruits and veggies depending on what region she's in. And you stay within the taboo diet, but still branch out enough that they shouldn't become thiamine deficient again. And that's where the negotiation occurs. So we're going to broaden mom's diet. She's hesitant to do it, but we'll do it by adding in some of these things. Like legumes are totally easily to access and high in thiamine. You continue to breastfeed. We want you to do that. And we supplement. And the baby gets better, goes home, and doesn't have beriberi again. And it's not just jumping to what my instinct was when I first went to lab of we must feed this baby multivitamins and change mom's diet completely, because why would you follow this taboo diet when it's clearly harming your child, to just slowly broadening it to something that's acceptable to both